I want to speak to Chris Quinn, who's the Northern Ireland Children's Commissioner. Chris, good morning.
Morning, Frank. How are you?
I'm very well. Chris, it's vital that young people talk about their mental health the way they would talk about a back injury or a sore knee. It's incredibly important we have the confidence to talk about it, isn't it?
It really is, Frank. This is Children's Mental Health Week, and part of what we're asking young people to do is speak to trusted adults to remove the stigma. As you say, if you had a back injury, a leg injury, you would tell people about it. Sometimes mental health is not treated in the same way. I'm a parent of 4 boys myself, and something that I've tried to do is to reassure my children that nothing that they tell me I won't be here to help with and to listen to. I think genuinely most parents, if not all, are very concerned about their children, and providing those safe spaces and those environments at home and in other places to have those conversations is really important. Part of the good news is that we have an assembly back up and running, and we have a mental health strategy. So we now need that strategy to be resourced, and we need public advertisements, we need services for young people, we need facilities at a community level to support young people's needs. Young people have said for a long time that they would like a curriculum in school to prepare them for life, and part of that curriculum would focus on mental health and coping skills. I think as part of that conversation, we need to distinguish between stress, de-stress, things that are going to put pressure on you in your life, and mental ill health, because these sometimes all get lumped together. So we need to teach young people about coping skills, about self-love, about how to take time out and care for themselves, and getting off screens, getting outside, enjoying their social lives and the environment would all be small steps that we can all take. It's very important to show empathy, and I guess a little bit of self-awareness is really important in these situations, to know your own triggers, to pause, to listen, and to understand that the world right now can be a very difficult place. There are lots of factors: cost of living, COVID-19, Brexit. All of these things impact us all, and children and young people suffer potentially more than others when in times of crisis. So as you say, Frank, yes, pause, listen, reflect, and really try and empathise would be my advice to parents and people that care for children and young people.
Yeah, it's good advice. It is Children's Mental Health Week. That's why we're having the conversation. Chris, thank you very much for your time this morning. Thank you.